Good morning. It's Monday, September 26th. And as usual, I went searching for an article to talk about. And I discovered that many hospitals in the United States are considered non-profit hospitals. And that means that they're a charity hospital. And this system was set up years and years and years ago when a group of nuns opened a hospital called Providence Hospital in the 1850s. It had 1 room and 4 beds, and the patients often paid their hospital bill, which at that time was $1 a day, with chickens or eggs or vegetables, stuff that they had grown, because they didn't have much cash. Right now, Providence Hospital is a huge non-profit hospital, making over $1 billion a year and having a reserve of $10 billion in investments and things like that. The money's outstanding, outrageous to begin. And what is a non-profit hospital? The definition of a non-profit hospital is a hospital that is willing to serve the poor being those who are defined at the poverty level or people on Medicaid. It's low-income group. And they're supposed to treat those people, those patients, for free. But Providence Hospital decided in 2018 that they were going to change their policy about how they treated these people. They quite often just asked them to pay, and then if the person didn't pay, well, that was okay because they were collecting the money under the non-profit system. And the non-profit system gives Providence Hospital huge tax benefits. And this is not a situation where they need the money because they're losing money, although they claim they're losing money, and that's probably just because they have the right accountant. And anyhow, they devised a system which was called Rev Up. The Rev Up system provided Providence Hospital's employees a detailed playbook for wringing money out of patients, even those who were supposed to receive free care because of their low income. And the New York Times discovered this during their investigation into what I will call hospital malfeasance of the worst kind. So I'm going to go through some of the instructions that were given to the employees when a patient was leaving the hospital. And remember, these people that I'm talking about, the patients, were not supposed to pay a dime. They qualified for non-profit care. But the training manual given to staff told them to tell patients that payment is expected. And then it went through a series of questions that you were supposed to put to the payments upon their release from the hospital. And the title of the document is Don't Accept the First No. And the first question that they were told to ask is, how would you like to pay your bill today? And if that did not work, then the employees were told to ask for half the balance. And if that failed, the staff could offer to set up a payment plan. And only as a last resort, the workers should tell patients that they may be eligible for financial assistance. So they go through this rigmarole trying to get money from these poor people, and at the end they tell them they might be eligible for financial assistance. And every one of them is probably supposed to not have to pay a dime. But this hospital is bent on making money. And a huge enterprise. Providence Hospital is a huge enterprise. They have hospitals all over the country. They are not a single unit. Now, if the patients were surprised that this non-profit organization was asking them for money, they had a whole series of explanations that they could give to the patient, as instructed by the Don't Accept No document. They were told to say something like, yes, we are a non-profit, however, we want to inform our patients of their balances as soon as possible and help the hospital invest in patient care by reducing the billing costs. And then you ask, how would you like to take care of this today? I ask you, is this a hospital or is this a group of con men running a healthcare unit? Sounds to me like these are a bunch of devious people who will do anything to make a buck. And let me tell you about the size of Providence. It has 51 hospitals and 900 clinics. And its revenue exceeded $27 billion in 2020. And it's sitting on $10 billion that it invests Wall Street style. And on top of that, it's entitled to many tax breaks, tax exemptions, because of its supposed non-profit tax status. So here you have a hospital with many, many units ripping off the government because of its tax exemptions and everything else, and then ripping off patients who are entitled to non-profit care. Non-profit care meaning that the hospital doesn't make a dime except what they're able to collect under the non-profit billing system, whatever money that is. Obviously, Providence is not the only non-profit hospital in the United States. There are over 5,000 hospitals in the United States, and over half of them are non-profit institutions. That means that the Internal Revenue Service requires them to provide services such as free care for the poor, and that benefits the communities in which they operate. And in exchange for benefiting the communities and benefiting the people in those communities, Providence avoids $1 billion a year in taxes. Now, if you're paying $1 billion a year in taxes, you're making a hell of a lot of money. And multiply that by 2,500 hospitals, give or take. Now, many of them are not as large as Providence, not as big a moneymaker as Providence. But think about the billions of dollars that these hospitals are getting away with, especially if they're not providing non-profit care the way they're supposed to provide it. Providence is not alone in ripping off the poor. Providence is not the only not-for-profit hospital that is doing the things that I mentioned in this rant. And that will require more research on my part. But every time I go looking for something to rant about, I find another ugly situation that exists in the United States of America, our once great country. See you in the morning. Bye.